Owner of Alliance Regen and Rehab. Um, there we go. So I'm a board certified physician in family medicine and osteopathic manipulative medicine. I'm fellowship trained, board certified in sports medicine. As I said, I'm owner of Alliance Regen and Rehab. I'm also a board member on the Pinellas County Osteopathic Medical Society. I'm instructor for Gulf Coast Ultrasound Institute, the International Association for Regenerative Therapy, the American Osteopathic Association of Prolotherapy and Regenerative Medicine, as well as clinical instructor for medical students and residents. I've been on numerous mission trips to Jamaica, Honduras, Mexico. In December, I'll be going to the Galapagos Islands, and then next year I'll be going to Greece to do OMT prolotherapy to help the local people with pain. So I'm going to tell you about something else that I do to improve the quality of patients' lives and give them their life back. I'll tell you about Karen. I see Karen about once a day. She's a 50-year-old female. She complains of hip bursitis, some fatigue, some weight gain. She's not as sharp as she used to be. She's got decreased libido. None of you know what that means. That means she's not interested in sex. She's got some night sweats. She's short-fused. She's got a recent diagnosis of osteopenia. Her husband thinks that she might be cheating on her because there's no hanky-panky. Karen's afraid to exercise out of fear of breaking her bones. Many of her friends and doctors tell her this is just part of aging. Her doctor checked the hormones and said everything's normal, don't worry about it. And she was offered a pharmaceutical to help increase bone growth. One of her friends and my patients referred her to me. So we did our exam. We did a complete panel of hormones. We saw that she had low testosterone and estrogen. Even though she was in the reference range as being normal, she was not optimized, and was the reason for her symptoms. We checked her full thyroid panel, not just a typical baseline hormone that most primary care physicians look at. We looked at everything. Ultrasound exam showed that she did not have bursitis. She had a tendon problem in her hip. That's one of the most common misdiagnoses I've seen in my career. So, is this normal aging? Do we lose our hormones because we age, or do we age because we lose our hormones? Just something to think about. So, low testosterone in women and men is an increased risk for Alzheimer's disease, cardiovascular disease, heart attacks, strokes, osteoporosis-related fractures, diabetes, and breast cancer, or prostate cancer in men. So hip bursitis is not bursitis. As I said, it's gluteal tendinosis. We get a drop in our hormones, and that degrades tendons and joints. So some myths about testosterone in women. It's only a male hormone. Actually, the androgen receptor is on the X chromosome. Women have 2, men have 1. So that tells you how important it is. It masculinizes women, makes them big and bulky, makes you look like a man. That takes like 30 times the dose of testosterone that we use. It has adverse effects on the heart. No, they've actually injected testosterone right into the coronary artery during a heart attack, opened up the artery, heart attack gone. It causes aggression. It's actually very calming. Think about these old men running around, they're cranky. They got no testosterone, they're bitchy. And it also has an increased risk of cancer. Not true. There's a breast surgeon who injected testosterone pellets around breast tissue, and it killed it. The cancer, not her. Does anybody ride horses in here? Anybody know what a mare is? It's a horse. Thank you. Anybody ever heard of Premarin? It tells you in the name what it is. Premarin. It's horse urine. Don't take it. That stuff causes cancer. So let's fix Karen. What are we going to do for her? Bioidentical testosterone and estradiol pellets. We give back what God gave you. Now she's got improved energy, focus, vitality, improved mood. She's not bitchy anymore. Her relationships are improved, and her husband is extremely happy. She's got improved body composition, no more night sweats. She wakes up in the morning ready to tackle the day. She gets home at night ready to tackle the night. She's building stronger, more resilient bones. We put her on desiccated thyroid medication. This is not Synthroid. This is real thyroid hormone. Now she's got weight loss, and we did platelet-rich plasma to her tendon to heal that thing, not a cortisone injection to break it down. And we also followed her up with PT. I got a guy for that. He's sitting right over there. So aging does not have to be miserable. We can and should age gracefully. Karen thought that being tired, achy, and miserable was part of aging. Karen found me, a doctor who listened to her, understood her physiology and her goals. Karen now realizes that hormones play a large role in her health and happiness, and she realizes that there's a natural way to correct this problem. Karen is now thriving, and her husband is now a patient of mine, so he can keep up with her. Even Karens deserve to be happy. Thank you.
That's it.
That's it. Any questions?
Any questions? All right, excellent.